Hi, I am Dr. Swapnil. I was a bit nervous when I started treating fever cases, but now I find it more interesting and challenging. Now we will start with first case of fever. Mother brought her 8-month-old child and he has mild cold which is watery in character and mild intermittent fever. And she told he is crying continuously since morning. On sponging, he is making movement as if he is feeling cold. So, by considering irritability with cold, the remedies came to my mind was chamomilla, arsenical and nux vomica. As the child was feeling cold, so I prescribed arsenic album 1 ml 6 hourly for 1 day. Next day, her mother came and told me there was no response and child is crying continuously and he has started with continuous fever and dry cough also. So, here our remedy has not acted and child started with continuous fever. I inquired the case in detail and she told me the child feels better by carrying only. So, on referring Phatak repertory, carried wants to be, I ruled out nux vomica and I prescribed chamomilla 1 ml 4 hourly and asked her mother to call up in the evening. In the evening, when she called me, that time there was no fever and irritability was also reduced. So I continued the same medicine for 1 more day. On next day, the child was alright, except her mother told me he is crying for some time after every cough. So again, the reference to Kent repertory was made for the rubric cries cough after. Under that, 8 to 10 remedies are there along with chamomilla. As chamomilla is covering this symptom also, I continued the same medicine for 2 more days and child was alright. In this case, what lesson we learn? Sometimes even after prescribing the indicated medicine, we fail. In such cases, we need to inquire further detail. Now we will start with second case. 2.5-year-old boy. He came with his mother and he has fever and the temperature ranges between 101 to 102 degree Fahrenheit. And her mother told he is dull and drinking large quantity of water and has not passed motion since 3 days. So, by considering dullness, thirst for large quantity of water and constipation, naturally the remedy came to my mind was Brahania. So I prescribed Brahania 1 ml 6 hourly for 1 day. On next day, the fever rose up to 103 degree. Now the question before me was whether to give Brahania 10 ml or sulfur 1 ml, which often indicated when your well selected remedy fails. I opted for second choice. I gave the child sulfur 1 ml 6 hourly for 1 day. On third day, the condition remains same. Now as it is the third day of fever, the mother was a bit worried and she told now he started complaining of pain in abdomen also. So on examination, there was nothing specific finding except mild tenderness in lower abdomen. That may be because of constipation. So I inquired the case in detail and she told the child was restless till 3 o'clock at night and he slept thereafter. So on referring Phatak and Kent repertory for the rubric midnight amelioration and Boger-Boning-Hussain repertory for constipation fever during, I found lycopodium was the indicated drug. So I prescribed lycopodium 1 ml 6 hourly for 1 day. Next day, her mother came with very smiling face and she told me my child was alright up to your second dose only and he passed motion also. So I continued the same medicine for 2 more days and child recovered fully. Here, in this case, the lesson we learned. The general advice is lycopodium does not follow sulfur well. But here, sulfur is not acted and lycopodium symptoms are there. So lycopodium was prescribed, which acted very nicely. And retrospectively, Whether Bioneotenum would have acted, one doesn't know. Now we will start with third case, which is also a 3-year-old boy. He came with mild cold and thick discharge from nose and nose block since 3 days. He started with fever since yesterday and the temperature ranges between 101 to 102 degree. But her mother said the child was talking unusually too much during fever. So the latter symptom I take as a peculiar one, and on referring Boger-Bonning-Hussain repertory for the rubric loquacity fever during. Under that rubric, 5 remedies are there, in which Merum Verum, we also called it as Teucrium, and Pulsatilla are coming closer. So as Teucrium is the highest marked drug with accentuated action on respiratory system, I prescribed Teucrium 200 6 hourly for 1 day. On next day, there was no fever, but there is no change in cold and cough also. But as fever has come down, I opted not to change the remedy and continued the same medicine for 2 more days. After 2 days, the child was better, except mild dry cough has remained, and he has not improved his appetite since the attack of cold. So, I prescribed Carbohydrate 200 3 times a day for 3 days, which often indicated in acute diseases to complete the cure. Now, we will take one more case. This is not of course of child. This is of one 41-year-old gentleman. He came at around 8:30 p.m. or 8:30 in the evening to our center. He started feverish feeling since 5 o'clock in the evening, and along with that he has mild body ache, mild throat pain, and he noticed one unusual sensation, that sensation of hot air passing through his nose on expiration. I found latter symptom as a peculiar one. So on referring Kent repertory, under the nose section, rubric heat in and sub-rubric air expired feels hot. Under that only 2 remedies are there, the Calibicrom and Rustox. As Rustox often come in cases of fever, I prescribed Rustox 1m 6 hourly for 1 day. Next day, when patient came, he informed me that even after taking your medicine, he continued to having fever and it rose up to 101 degree after 11 o'clock at night. And he did not sleep because of body ache and fever. So I inquired the case in detail, and he told me, or he narrated the symptom, that his usual meal also he is not feeling salty enough. So again I referred the Kent repertory. Under the mouth section, taste, and the rubric found was salt enough, food does not taste. Under that, 8 to 10 remedies are there, out of which arsenic album was covering the restlessness and night aggravation. So I prescribed arsenic album 1m 6 hourly for 1 day. Next day, there was no fever and other symptoms are also better. So I continued the same medicine for 2 more days and patient was alright. In this case, the lesson we learned, or it is difficult to explain why Rustox has not acted in spite of it is selected on the basis of peculiar symptom. Now I will finish with my cases of fever. Thank you.